the first discovered my murmur about 20 years ago. They finally decided that I had reached the point where I couldn't have the open heart surgery because I was too vulnerable for that. And so then they started hearing about this valve, this new procedure with the valve. So they decided I was eligible to do this surgery.
You and your doctor have discussed the need for a transcatheter aortic valve replacement, the procedure, and potential risks. This program will provide information about your hospital experience, and you'll hear from others who have had this procedure.
This is an aortic valve replacement for patients where the risk of conventional surgery is a little higher, and so this provides a safer alternative. Patients like it because it's much less invasive. They don't have a big incision to heal from. They only have small incisions, usually in the groin, and they can go home in just a couple of days. It doesn't set them back for several months like open heart surgery does. We have two different transcatheter aortic valves available to us. One is expanded by using a balloon inside it to stretch the metal frame, and the other is a self-expanding, this sort of memory metal. This valve is scrunched into a catheter, and when the catheter is removed, the valve opens itself up. Instead of cutting out the patient's bad aortic valve, what we do is actually put this catheter with the valve inside their aortic valve, and when the valve opens, it just pushes their bad valve out of the way, pushes it out to the side, and these valves are then left stuck inside there and functioning in place of the patient's diseased aortic valve.
A day or two prior to your scheduled procedure, you will meet with a cardiac rehab nurse who will go over your history and medications and provide instructions on how to prepare for your procedure, such as where to go, when to arrive, and when you must stop eating and drinking. You will also have blood drawn, provide a urine sample, and have a chest X-ray and an EKG. On the day of the procedure, use the surgery entrance valet parking. Take the elevator to the main floor surgery procedure check-in desk. When you check in, a patient ID band will be placed on your wrist. You will then take the elevator to L1R Surgical Admission Unit. If needed, a wheelchair is available. In the surgical admission unit, you will be prepared for your procedure.
And go ahead and spell your last name for me, please.
An IV will be placed and your health history reviewed. You will be scrubbed and shaved, and your anesthesia provider and doctor will meet with you. Your family member or support person may remain with you until you are taken to the procedure room.
And then they're taken into a special operating room, and this operating room is called a hybrid operating room. Patients should expect as they go in there to see a lot of equipment. There's big X-ray machines and anesthesia machines and a lot of lights. And then after the patient's asleep, we begin the procedure.
Your family member will be taken to the Skybridge waiting room where they will be shown how to follow your progress and receive updates. Your surgeon will meet with them when the procedure is finished. At the completion of the procedure, you will be moved to the cardiac intensive care unit where you will have multiple lines and be closely monitored overnight. It will be about 40 minutes before your family member or support person can visit you. Your nurse will get you up and sitting in a chair while you are there. When you are well enough, you will be transferred from the cardiac intensive care unit to the acute care unit. Here you will prepare for discharge by using an incentive spirometer to re-expand your lungs and to prevent pneumonia. It's important to start moving. You will walk in the halls with physical therapy, shower, and sit up in a chair as much as possible and for meals. Your blood sugar will be monitored even if you don't have diabetes. When it's time for discharge, your nurse will discuss your wound care, lifting restrictions, and follow-up appointments you will need to make. You will also receive a wallet card to carry with you that provides important information about your existing heart condition. If you are interested in cardiac rehab, you will receive a call about 1.5 weeks after discharge to schedule it. In some cases, you may need to go to an extended care facility to gain more strength in order to manage at home.
Some patients have a lot of other medical problems, and some of those patients have to be here for days or a week or more. Some patients have to go to a care facility because they're not strong enough to go home. Those are all generally based on their condition prior to coming in rather than the procedure itself. If a patient is coming in good condition from home, usually they'll be able to go back home in just 2 or 3 days.
My daughter took care of me for a couple of weeks at her house. That was wonderful too, because they're just some of my favorite people, and they baby me and spoil me, so that was wonderful. I think immediately I felt, you know, it might have been, you know, mental, knowing that I had a new heart valve, but I felt like I had more energy. I think they told me not to lift anything really heavy for a while. Of course, I can't lift anything very heavy anyway. I think they feel like they can really help you, and it is such a wondrous thing what they can do for you with so little pain and anguish, you know. So I highly recommend it to anyone that has a situation like this.